Hi. So today what I wanted to talk to you guys about is low back pain. The problem with sending out videos on low back pain is that it can be caused by a variety of issues. What I would recommend is that you do get diagnosed by a healthcare professional with what you have. But if you try these exercises and they work, then keep doing them. If you try these exercises and you feel worse at all, then don't do them. What I'm going to teach today are mobility exercises for your spine. So this is not stretching and it's not strengthening. It's actually mobilizing the joints so that they can start to move in a way that's functional. Because sometimes we get dysfunction in those joints in our spine. The areas get stuck, and then that can cause a pinched nerve or pain down our body or issues with our discs. So let me explain that a little bit better. Here's what your spine looks like. What I would like is for all of these joints in your lower spine here to move really nice and easily. There are several joints on each one of your vertebrae, and if any of those areas are stuck, then it's going to cause some immobility or catching, if you will. The purpose of these exercises, and they are similar to McKenzie Exercises. So if you want to Google McKenzie Exercises, there's step-by-step how to do them. But these exercises, what they're going to do is they're going to get your spine to start moving in the correct direction. They also can help with issues with a disc. And once again, I recommend getting diagnosed by a healthcare professional to see if you do have a disc issue. But in the meantime, if you need to do something, this makes you feel better, then do that. So here are your discs in your spine, and a lot of times they get to where they can be squished too tight, which can cause them to bulge. Usually they bulge posteriorly. Not everybody, once again, get help from a professional. But for people that do have this disc bulging in this specific way, this McKenzie exercise is very helpful for that. So this is a traditional McKenzie exercise. Just a second. What you're going to do is you're going to lay face down, and you're going to do pretty much the worst yoga that you can do, because I don't want you to use your muscles. What I want you to do is use the muscles of your arm, but nothing in your back. So you'll lay face down, relax your low back, and then do a press up. So you're going to press up here. This is as far as I feel comfortable. Some people press up further, some people are going to be lower. But you'll press up until you feel comfortable or uncomfortable. And then you're going to take a big breath and try to let your low back just sag. Try to let everything relax in your low back. And then you'll go down. And you're going to do 10 of these. Up again and relax. Remember, all the strength that I'm using is in my arms. It is not in my low back. If that exercise makes you feel better immediately, as soon as you're done with all 10 repetitions, and it makes you feel better, then it's an exercise that you can continue to do on a daily or hourly basis, depending on where you're at and what's going on with you. So that would be my first recommendation, to get mobilization in your spine and hopefully pressure off of a disc off of a part of your spine. The next exercise that I'm going to recommend is a little bit easier than that one. And what you're going to do, you can start with this one. Let me raise this up for you. Is you're going to do the hula. So this is just, once again, a way to get those joints to get lubricated and to start moving. So it's not about strengthening, and it's not about stretching. It's really about moving the joints, and it's about the amount of times you do it that's going to start to get them to go in the correct direction. So you have to do this in repetition, 10 times in a row. Okay, so what you'll do is you'll just kind of be about this far from the wall. You're going to put your hands on the wall, and then you're going to just rotate your body like you're doing the hula. You're going to rotate in a circle. And you might find that one area catches, and if you can make it through that, make it through that. And you'll go 10 times in one direction, and then you'll go 10 times in the opposite direction. And what you might notice is that it's easier to go in one direction versus the other. This direction's easier for me. So after I finish all 10 this way, I'm gonna recheck that spot that hurt, and it already feels better. So now I can do all 10 with better range of motion this way. I would recommend trying the hula first before you try the McKenzie exercise where you're face down, the press up. And then the next thing you can do is what you're trying to do is you're getting these joints to move in all of the directions. So you're going forward, and you're going backward, and then you're going to side, and then you're going all the way around to make sure everything's moving correctly. So the next one you're gonna do is you're gonna lean against the wall like this, and you're gonna just do a hip dip. So you're gonna dip your hip in. If you can see me doing that. So once again, I'm trying not to use any muscles in my lower body. I'm just trying to get that part of my spine to move correctly. And then you would turn and do 10 on the opposite side. Just like that. The last one would be a forward fold. If you can do a forward fold standing, try that. Once again, you're not trying to stretch anything. You're just trying to mobilize these joints. And so you'll just kind of hunch forward and bend forward one vertebra at a time. And then you'll come back up, and you want to do 10 of those. You may not be able to do this. An easier way to do that would be to have a seat, to sit down on a chair, bend forward and kind of wrap your hands around your ankles, and then come back up, and then bend forward and wrap your hands around your ankles and do that 10 times. That'll be better than doing it standing. So those are my suggestions if you're having some, people call it a hitch in their back or chronic low back pain. Try to do some of this mobilization and see if it's helpful. If it's not, then these are not the exercises for you. This is for a specific type of issues with your low back.